So welcome to the Nutrition for Diabetes webinar that we are offering today as part of Cone Health's Live Life Well Employee Wellbeing Program. My name is Kate Watts. I'm a registered dietitian nutritionist with Cone Health. And so we are going to cover a good amount of information today. And this session will be recorded and made available on our Cone Health Live Life Well YouTube page in the next week. And I will also be sharing today's presentation slides with everyone. So I will be emailing these out after we finish this live webinar today. So as we go through the session, please feel free to ask questions or share any comments or personal experiences you have. You can open up the chat box and interact with me there as well as the rest of the group. There's also the Q&A function that you can use to ask a question, and it will alert me that there is a question to be answered. And the last way would be to use the raise hand button, and then I will know to request for you to unmute yourself and you can ask a question out loud or share any comments that way. So please feel free to interact as we go through the material today. So thanks again for joining me. I am going to mainly be going through some of the research-based or evidence-based standards of care for diabetes and really just pulling out pieces directly related to nutrition and food. So this 2022 version of the Standards of Medical Care in Diabetes is a extensive clinical diabetes literature review, and it is performed by the American Diabetes Association and is updated each year. So most of what I'm covering today is also highlighted in this report, kind of the gold standard and the most up-to-date research behind diabetes management. So we're going to start out with looking at healthy eating patterns and what is the best eating pattern for managing blood sugar and diabetes. And again, we're going right to the research with this. So today is more of an advanced nutrition approach, looking at the literature out there. However, we will be tying in some practical resources all along the way. So let's start out with healthy eating patterns. There is plenty of evidence out there that suggests a variety of eating patterns are appropriate for managing diabetes. And so this is good news because our food choices do not have to be completely locked into one little box because we have diabetes. There's actually many different eating patterns and eating styles that will work perfectly well to help us manage our blood sugar and prevent any complications of high blood sugars as we age. So our choices really then can be based on an individual approach, and we can look at current eating patterns, that individual's eating preferences and their personal metabolic goals, and really help find a plan that works well for them as an individual while also managing their blood sugar. So that's really encouraging for a lot of people. Overall, nutrition quality of food that we consume should definitely be considered because that is associated with lowering risk of type 2 diabetes and complications of diabetes. So these, nutrition quality really emphasizes choosing whole grains, choosing more legumes or beans as our plant-based protein foods, snacking on nuts, adding those to our entree dishes and meals. Of course, increasing fruits and vegetables. We'll talk more about that today, of course. And then minimizing refined and processed foods. So we're going to look at a few different types of eating patterns that have some research behind them. And we're also going to look at what is common between those different eating patterns. What are some common factors? So we'll start with low carbohydrate. Should be no surprise that this one is on here. A low carbohydrate eating pattern is the kind of classic choice for people with diabetes because carbohydrate is the nutrient that is readily used as energy, and it is therefore the primary dietary influence on post-meal blood glucose. So our body loves using carbohydrates for energy, but these are the foods that increase blood sugar directly. The more carbohydrate we eat, the higher our blood glucose or blood sugar will be after that meal. And so really looking at the portion sizes and the amounts of carbohydrate is a very important tool for managing blood sugar for those with diabetes. So research has shown that these low carbohydrate eating patterns can reduce A1C and reduce the need for anti-hyperglycemic medications or diabetes medications. So we're going to talk about A1C and blood sugar quite a bit today in terms of results in the research. And so blood sugar being the amount of blood glucose shown at that moment in time, and that changes all throughout the day, fluctuates all throughout the day. Whereas A1C is more of a bigger picture average. So someone with diabetes typically has an A1C blood test drawn every 3 to 6 months or once or twice a year with their primary care provider, to kind of get a bigger picture of what their blood sugar does on average during those previous 3 months. So we will again be seeing how different items in the nutrition world can impact in a positive way that A1C value. All right, so the next healthy eating pattern that we have is low fat. And so the effect of a low fat eating pattern reducing diabetes risk appears to be mostly related to its effect on weight loss. And we're going to talk a little bit about weight loss considerations later on today. Now, lowering total fat intake does not consistently improve glycemia or cardiovascular disease risk factors in people with type 2 diabetes. So we do think it's kind of just more of that correlation of a low fat eating pattern can help with weight loss, and weight loss can help with improving glycemic control. The next eating pattern is the Mediterranean style. So this one, it kind of has its trendy moments where everyone's talking about it, but overall it has been a very well studied eating pattern over time. And so the PREDIMED study is one such intervention trial that showed after 4 years, the group that was placed on the Mediterranean diet had improved their blood sugar management and had reduced their need for glucose lowering medications. The DASH diet stands for Dietary Approaches to Stop Hypertension, and it may contribute to an improvement in insulin sensitivity separate from weight loss. So whether or not someone loses weight on this diet, they do tend to see improvements in glycemic control. And this can be important for the long term of glycemic control as well. So again, independent of what the weight status is, alongside this, what is also pretty much a low fat diet, the DASH diet. And the last one I will mention today, and it's mentioned in the research, is a vegetarian or vegan eating pattern. We also like to call this plant-based nowadays, but meta-analysis shows that vegetarians versus non-vegetarians have a lower risk of diabetes, and that those with type 2 diabetes who follow a vegetarian or vegan eating pattern, they did see their A1C reduced by 0.3 to 0.4%. So with the A1C test, it is a very small scale test result, and it's given as a percentage. So even these 1/10 of a percentage changes are noted in the research and will be, listed on my slides here. As we get closer to like a 1% decrease, that is definitely a significant improvement to blood sugar. So this is just giving an idea of some of the eating patterns out there that have been researched. It's not saying that one is necessarily the right way to go. Certainly, I don't tell all my clients with diabetes that they need to go vegetarian or vegan, but it is helpful if someone's interested in that or is already experimenting with that to be able to show that it is an appropriate way to do things when you are also wanting to manage your blood sugar. So I want to mention now we are going to be talking about individual nutrients today, but I think it's important to talk about the role of this synergizing effect of phytonutrients on our metabolic pathways and therefore our health outcomes. So basically, if we took an example like the Mediterranean diet here in the center circle, we have all the main food elements of a Mediterranean diet, food and beverage elements. We see they use a heart healthy fat with olive oil. They have a lot of plant-based choices with vegetables, fruits, grains, and legumes, as well as nuts and seeds. They definitely follow a lower animal-based protein diet. They have moderate portions of wine. So what we notice from all these foods, it's not just one nutrient or one food that really provides the benefit. It's how they're all working together. And so these different foods provide individual macronutrients and micronutrients, vitamins and minerals. And then those different components, they play a role in whether our cholesterol or blood pressure is lowered, if our inflammation levels are lowered, if our body fat levels are lowered, how our blood pressure is impacted, how our blood sugar is impacted. And so you can see how the different components of our overall picture of health are positively influenced by the positive balance of this diet and how it works together. And so then all of those intermediate outcomes, blood pressure, blood sugar, cholesterol, that is really what goes into the ultimate equation for reducing this person's risk of metabolic syndrome and diabetes, or helping managing some of these chronic diseases. So just want to really touch on the importance of the overall picture and quality of diet versus getting too focused on one individual nutrient as we go through the research today. So common factors among these healthy eating patterns include they all emphasize non-starchy vegetables. So when we get to our practical methods today, we're going to talk a little bit about starchy vegetables versus non-starchy vegetables. They also all minimize added sugars and refined grains and encourage us to choose whole foods over highly processed foods to the extent possible. So some of the things that these eating patterns commonly minimize are added sugars and sweets. And we know that these are some of the items that traditionally are known to really spike those blood sugar levels for those that have diabetes. So desserts and processed foods, candies, regular sodas, other sweetened beverages, these are certainly in any eating pattern we choose going to need to really be kept a close eye on if we are wanting to be successful in managing our blood sugar. Now, with the methods we're going to talk about today, allow some wiggle room to enjoy all foods in moderation, but it's really going to come down to how much and how often and with what else we combine these foods for our, again, that big picture of our eating pattern. So as I mentioned, I'll be sending these slides out by email today to everyone that registered for our webinar. And so these links you'll be able to click on, and these are just some resources for each of these different healthy eating patterns if you want to learn more. I've found that these can be pretty helpful, just overviews of these healthy eating patterns. Now, we talked about how these choices can really be individualized for each person. And so I just wanted to also plug and promote the services Cone Health has around working with a registered dietitian. They provide a unique service called medical nutrition therapy. And when someone works with a dietitian regularly over time, they see in research a decrease in A1C up to 2%. And that's very significant because that's right in line with the average. On average, our starting diabetes medications decrease A1C from 1 to 2%. So imagine those two in combination, even if you were to start, say, on metformin and also be working with a dietitian, how you can really improve those lab values. So, what does medical nutrition therapy include? They promote and support healthful eating patterns to help improve overall health, A1C, blood pressure, and cholesterol. It also, working with a dietitian, they can work with you on achieving and maintaining body weight goals, and ultimately the goal being to delay or prevent complications of diabetes. Another goal of medical nutrition therapy is to address individual nutrition needs. So there may be another chronic disease you're balancing along with diabetes that makes it a little more complicated. It may be that you have certain personal or cultural preferences around food that you need help how to, fit about create that cultural food choice into a balanced diet for your blood sugar. And they also really help to maintain the pleasure of eating. So not feeling like that you can't have the foods you love anymore, but how to balance those choices with your health goals. And then, really, the big part of working one on one with a health professional like a dietitian is that they're going to have practical tools that you can use for those day to day choices, day to day food and meal planning, and how to balance that with diabetes. So, working with a registered dietitian at Cone Health often requires a referral from your primary care physician or your endocrinologist. And if you are interested in more information, you'll have this link to their website when I send out these slides today. So let's talk about some of those practical tools for meal planning with diabetes. They actually did a controlled randomized trial on nutrition education methods, and they looked at the impact on A1C after 6 months of using the plate method and after 6 months of someone using the carbohydrate counting method. So we're going to talk about both of those today. This research study found that both of these approaches were effective in improving A1C, particularly for those who had a higher A1C, so an A1C of 7 to 10%. And lastly, they found that the plate method may improve control for both higher and lower numeracy individuals with diabetes. So this would probably be the simpler tool to use, but they both are quite effective, and we're going to talk about both of them today. But first, I always like to mention the glycemic index because we get questions around glycemic index for diabetes control quite a bit. So basically, the glycemic index is a ranking of carbohydrate foods. So again, those foods that impact blood sugar the most. And they're ranked on a scale from 0 to 100 according to the extent in which they raise that blood sugar level after eating. So you can see on this chart that a high glycemic food is going to have a very quick and high spike of blood sugar after it's consumed, and then a quick drop of that energy as well. Whereas a low glycemic index food is going to have a much more gradual release of energy of that blood sugar into the bloodstream. So low GI is anything less than 55 because of their slow digestion and absorption. And so low GI, in theory, those foods can help control appetite and weight. So when we put this into practice, when someone's using the glycemic index to make choices around food, they often consider the glycemic load, which reflects both that GI number and the amount of carbohydrate in a normal serving size of that food. And so it's a simple equation, and then we look at on the glycemic index and glycemic load, we have high, moderate, and low. So this is how it works. However, when we look at the research, studies have found really mixed results regarding the effect of a GI and glycemic load on fasting glucose levels and A1C. And so they have stated in research that it is unlikely that a low glycemic index diet reduces disease risk or health outcomes. And the reason for this is that when we're eating foods, we rarely are eating them alone. We often are combining different types of foods. We're often combining them with some kind of fats to flavor the food. We've often added some kind of protein or some kind of fiber-rich vegetables, and all of those different nutrients can also impact the rate in which that food is digested and absorbed. And so therefore the glycemic index and glycemic load is not really practical in real life. It can be helpful in seeing what foods are a lower GI food that we know would be probably a better choice for blood sugar. But because of the um, indirect way that that food's actually going to enter our body, it's not going to be standing alone. We don't tend to recommend that plan for individuals with diabetes. So with that being said, a practical tool that is highly recommended is the diabetes portion plate. And so you may be familiar with this tool. You may have seen it before. It is a very visual method for basic portion control and balance. So what we see on our portion plate are three different sections, and so one half of the plate is filled up with non-starchy vegetables, and that's the green section. So these foods have little effect on blood sugar, whereas the other half of the plate are starch and bread quarter of the plate. These are the foods that impact blood sugar the most, and so we do not have to eliminate these foods from our diet, but we do need to be very conscious of the portions, the amounts of these foods that we're having at each meal and snack, because we know those are the ones that are going to raise blood sugar directly. Whereas our protein foods, whether it's animal protein or plant-based protein, these foods taking up a quarter of our plate can slightly raise blood sugar, but they're not going to have as much of effect as the starches. And they actually are a great pairing with our starch foods because these protein foods are really going to keep us full for longer, keep us satisfied after our meal, and help with appetite management. Whereas the vegetables also are going to really provide tons of nutrition benefits, antioxidants, fiber, all kinds of phytonutrients, and also fill up our stomach with, again, that volume of low calorie, low carbohydrate foods. So the balance of this portion plate really is important because we don't just want to focus on limiting carbohydrates or starches. It's equally important to focus on increasing our fruits and vegetables and always having a protein on our plate as well. Again, it's that food synergy, it's that balance that's really what helps us be successful and get the nutrients our body needs. We don't want to be too deprived or restrictive when we are trying to eat for our blood sugar. So managing portions of starches is important, and that quarter of the plate includes grains, cereals, breads and pastas, rice, tortillas, as well as starchy vegetables like potatoes, yams, peas, beans, and corn. And so these are some of the foods that were traditionally told to diabetes in diabetes education for us to really avoid these, but they are very nutritious foods, especially the whole grain versions of these foods. And so just limiting the portion to half a cup to a cup at meals in that quarter of your plate can be very effective, and you can still enjoy these foods, which are often people's favorites. So it's nice to be able to include them in small amounts. So here are some examples of real life meals arranged on the plate in this diabetes portion plate style. So you can see we want colorful meals with lots of fruits and vegetables. Doesn't have to just be one half of a plate of salad or a whole half of a plate of steamed broccoli. You can have variety. Um, and of course, varying your protein options is a great way to get, just balanced nutrition from different proteins. You see that they have chose some very fiber rich starches here, which we're going to talk about fiber. We've got a mashed sweet potato and a brown rice, so very healthy options as far as which grain or starch they have chosen. And so we know that reducing overall carbohydrate intake for individuals with diabetes has demonstrated the most evidence for improving glycemia and may be applied in a variety of eating patterns that meet individual needs and preferences. So this is personally my favorite part about using the portion plate method is it can be used across all different cultures. It can be used across all different eating patterns. It can be used in many different situations, whether you're at an event and you're going down the line, filling up your plate from the buffet. You can use this visual, or if you're ordering at a restaurant, or if you're meal planning at home for the week, it's a very easy template to use. So what you need to master is identifying which foods go in which category. And then the only other thing to master is just the portions in balance with each other. So trying to have twice as many vegetables filling up your plate in comparison to starch or protein. So that is the portion plate method. I'm not seeing any questions coming in yet, but y'all let me know if you have questions or comments. I'm going to move on into our second practical method, which is carbohydrate counting. So carb counting is kind of the more advanced method for managing blood sugar with food choices, and it can help plan for and track exactly how many grams of carbohydrate are going to be consumed in the day. And so this is especially useful for individuals who are taking an insulin to carb ratio or on insulin because you can be much more precise. But of course, it's going to take a little bit more intentional time to use this method in comparison to the portion plate method. So with carbohydrate counting, 15 grams of carbohydrate is considered one carb choice. And so with education, with a certified diabetes care and education specialist or with a registered dietitian, they sometimes are going to be using carb choices. Sometimes we just go off grams of carbohydrate. And on average, now this changes based on each individual's goals, and that's why working with a health professional is very, a good choice for this method. But on average, a carbohydrate goal is going to be 45 grams of carbohydrate per meal, which is 3 carb choices or carb servings, and 15 to 20 grams of carbohydrate per snack, which is 1 carb choice. And so again, it's much more precise, whereas the portion plate method, we are limiting a quarter of our plate or about a half a cup to a cup for starch or carbohydrate, filling the rest of our plate up with foods that don't increase our blood sugar as much, like vegetables and proteins. With this carbohydrate method, we're much more precise in that. And so where do we find the grams of carbohydrate? You can find this on a nutrition facts food label. If the item you're consuming doesn't have a food label, they have reference books that you can buy. Calorie King is a very popular one. Also, food database websites or an app on your phone. There's lots of apps where you can track food and it has all the nutrition information just like you would see on a label. And the exchange system is also a method that is a little bit older that we used to teach, so that can be helpful in determining amounts of carbohydrate. So if we're looking at this nutrition facts label, looking at the serving size, it's telling us that for 1 cup of this food, there are 46 grams of total carbohydrate. So that would fit pretty closely to the amount we would aim for at each meal. And so if this 1 cup of your food was on that quarter of your plate, we are also pretty much in line with these carbohydrate goals. So again, both methods are very useful in managing blood sugar after your meals. This one is just a little bit more precise. So I see a comment about how can we use a portion plate for Chinese food. So let's do a little bit of an example. If we were to order some Chinese food, we would have the first step would be identifying where our starch or carbohydrate is coming from. And so with Chinese food, I feel like that typically is going to be rice or maybe some kind of noodles or lo mein. So whatever kind of starch or carbohydrate, so let's say it's rice, we would serve ourselves a fourth of our plate with that item, or approximately 1/2 to 1 cup of that item. So it would be rice. And then we're going to look for our protein. So that is going to often be a animal-based food. So chicken or beef or seafood of some kind, shrimp, or it could be a plant-based protein like a bean. So like a soybean, edamame is pretty popular in Asian food. It could be tofu or other kind of soy product. So that's going to be the other fourth of your plate with the protein. And then you really want to fill up, the challenge is to fill up half your plate with non-starchy vegetables. So with Chinese food, I think this could be some stir-fried vegetables, maybe in some soy sauce, and just get a good variety there. So broccoli, carrots, zucchini, onions, whatever you like, mushrooms, and just fill up the other half of that plate. So that would be an example for that. And of course, if you're not having as many of the cooked vegetables, you could always supplement that with like a side salad. I think Chinese restaurants are really good with doing, salad with ginger dressing, and that would be a good option for some vegetables as well. Great question. Thank you for that. All right, so let's keep going into beverages. So the portion plate method and the carb counting method, both verified through research, both great options. Some people are more into the numbers. They like to be more precise. Others really like the visual of the plate method. But when we talk about our food choices, we also want to consider our beverage choices for blood sugar. In America, 35% of added sugar intake comes from our sugary beverages. So, things like sodas, sweet tea, sports drinks, sweetened coffee drinks. So, really looking at those nutrition labels as well and looking at the amount of carbohydrates in our beverages can be really helpful. And the goal is to shift from those sugary beverages to more unsweetened options. And really encouraging that water intake as the best choice and trying to make sure we're staying hydrated with enough fluids, but especially from water. The other recommendations are around alcohol and caffeine. So with alcohol, moderation is key. The guidelines from the dietary guidelines for Americans is equal 2 or less drinks per day for men and 1 or less drink per day for women. And here are the serving sizes of those drinks here. And for caffeine, up to 400 milligrams per day is the recommendation, and that is equivalent to about 3 to 4 8-ounce cups of coffee. Now, for these drink choices, if we think back to the goal for a meal is 45 grams of carbohydrate on average. So some folks it may be more like 60 or 75 grams. Some people may be aiming for more like 30 grams of carbohydrate per meal. If we think about those numbers and then we look at the amounts of sugar in these common medium-sized drinks, you'll notice that we easily can go over a meal's worth amount of carbohydrates simply with what we are drinking. So just really something to consider. Personally, I like to eat my carbohydrates rather than drink them. If you are indulging in a sugary beverage, you may want to really watch what you're having at that meal and really go heavy on a lot of vegetables and protein if you're going to have a sweetened drink at the same time, because that's going to really take up the bulk of that carbohydrate load that your body can handle at one time. So really trying to shift, so a gradual change. We don't have to cut everything out completely, but looking at currently how much you consume and gradually reducing that down and switching those sugary drinks out for water, carbonated waters or flavored waters, unsweetened teas, herbal teas, hot teas, black coffee, or just watching how much sugar or sweetener you're putting in your coffee. And then just as a note that 8 ounces of cow's milk provides 12 grams of natural sugar. It's not added sugar. So that's kind of my cutoff if I'm looking at drink products that are low in sugar. I like to look for ones that are, 12 grams or less per serving. That's kind of a good just standard when you're choosing some of those um, flavored drinks. So what about artificial sweeteners? As we know, artificial or non-nutritive sweeteners, they can reduce overall intake of calories and carbohydrates. So they do not directly increase blood sugar the way that added sugars or natural sugars do. However, there's not enough evidence to determine if these sugar substitutes being used over long term actually help reduce our body weight or our cardiometabolic risk factors, and that includes glycemic management. So they're not shown to help improve blood sugar. We just know that they're not going to raise blood sugar directly after we consume them. So these low calorie or non-nutritive sweetened beverages, artificial sweeteners are what make your diet sodas taste sweet. And this is how you could make sweet tea at home with an artificial sweetener without it spiking your blood sugar. So these can certainly serve as short-term replacements to those sugary beverages. However, people with diabetes should be encouraged to decrease both sweetened and artificially sweetened beverages and use other alternatives that are more natural with an emphasis on water intake. Okay, so that's kind of the long answer to can I use artificial sweeteners? Yes, absolutely. Use them as a tool. They can be used as, substitutions in baking and etc. However, we still want to consume them in moderation. There are also some considerations for alcohol intake for those living with diabetes. Alcohol can increase our risk for delayed hypoglycemia, which is low blood sugar, and that can be minimized by consuming alcohol with food and by checking blood glucose frequently after drinking. So if you check your blood sugar at home, if you have a glucometer at home and you are having some alcohol with, the holidays coming up, it's good to check your blood sugar more frequently just to see how it's being affected. And just like everyone else, you always want to eat when you're having alcohol, and that can help stabilize those blood sugars and reduce a risk of a low blood sugar occurring. Also, just to consider, that excessive alcohol intake beyond those moderate limits set by the dietary guidelines can contribute to high blood sugar and weight gain. Many of our alcoholic drinks do contain significant amounts of carbohydrates and added sugars. Especially mixers that we use for mixed drinks when we're having liquor or spirits. Many of the craft beers are much higher in carbohydrates compared to light beers. So what you choose definitely plays a role, but again, if we're having excessive portions of those items, we can definitely see our blood sugar levels increase, and as well as weight gain, which can again impact the blood sugar levels too. So just really wanting to follow those guidelines for moderation for alcohol intake. So now we're going to get into my favorite part, which is looking at some of these individual nutrients that can help benefit those of us managing our blood sugar. So we're going to start with fiber. I already mentioned it a couple times. The research tells us that a regular intake of enough dietary fiber is associated with lower all-cause mortality in people with diabetes. And the amount of fiber that's considered sufficient is 14 grams of fiber for every 1,000 calories we consume in a day. So a standard daily calorie intake amount is set at 2,000 calories. And so that would be 28 grams of fiber for the day. Us Americans tend to fall very short of that goal. We definitely have some work to do in our fiber intake. There has also been some studies looking at high intake of fiber, so going above and beyond those recommendations of 50 grams per day. And they did see that it modestly reduced A1C, but also had some side effects. It caused flatulence, bloating, and diarrhea. So I think really just aiming to work gradually up to that standard goal of between 25 and 28 grams per day is a good starting place. And you do want to go gradually as you increase your fiber to help reduce any side effects of that change in your diet. So they did do some studies on fiber supplements because those are quite popular on the market today. And they found that 7 to 15 grams per day of soluble fiber supplemented for a median duration of 8 weeks resulted in an average A1C reduction of 0.5 to 0.6% for those with diabetes. So this would be your Metamucil or your Benefiber type supplements. However, we do really encourage getting fiber from food first, going back to that picture of food synergy and all the other amazing benefits you get from those foods. So really trying to look at foods naturally high in dietary fiber and doing that over supplementation because you get the added benefits of phytochemicals and micronutrients and other things that are going to benefit our health and prevent disease. So most fiber, the reason fiber is so helpful in particular for diabetes is that it's not digested the same as other carbohydrates. So a high fiber carbohydrate food is going to be a much healthier choice for your blood sugar than a low fiber or high sugar carbohydrate food. And often those are our refined foods, our packaged processed foods that are not going to be as good of a choice. So instead of raising blood sugar levels like those other carbs, fiber really helps keep our blood glucose from rising too fast, keeps us really full and satisfied, not to mention it's great for digestion and heart health, and fibers in all of our plant foods. So our fresh fruits, our fresh vegetables, whole grains, beans, nuts, and seeds. And again, when we use the plate method and load up half our plate with these fruits and vegetables, we are automatically getting that extra benefit of fiber. So let's talk about some other beneficial nutrients. So we've got vitamin D. When we look at the risk of diabetes, we see that low serum concentrations of vitamin D are associated with impaired glucose tolerance and having diabetes. So we do know there's some kind of correlation going on. It might not be direct or cause and effect, but there is a association. And so we've also seen possible evidence for improving blood sugar control for those with type 2 diabetes when they supplement with 1,000 international units of vitamin D every day for 12 weeks. Now, that being said, for all of this research I'm about to go over, there's no reason to, it is not recommended to take a supplement across the board for everyone. This needs to be very individualized. You want to have your blood work done to actually see if you are low in any of these levels before discussing with your provider if you should supplement a certain nutrient. So for someone that is low in vitamin D, which is a big majority of Americans, then supplementing with vitamin D may be helpful. Not only with other side effects of low vitamin D, but also specifically with blood sugar control. So magnesium is another one where if someone is low in magnesium, we see through meta-analysis of our randomized controlled trials out there, which is really kind of the gold standard of research, that magnesium supplementation of various types and amounts over 12 weeks helped improve glucose parameters in patients with diabetes and insulin sensitivity in those at higher risk of diabetes. And then with vitamin B12, specifically for people with diabetes who take metformin as part of their management plan, they should always have an annual vitamin B12 test done, which your provider likely already does. And this is because metformin use is associated with a B12 deficiency used long term, which is easily fixed with supplementing B12. But the side effects of B12 deficiency look very similar to the effects of anemia or peripheral neuropathy. And so it is helpful to keep an eye on those B12 levels for people that are taking metformin for long periods of time. And next, I want to touch on some science around what I considered popular advice. So things that I often get questions about that people hear, oh, my uncle so and so told me that I should take cinnamon or drink vinegar for my diabetes. So let's see what, if there's any fact or fiction behind those claims. So with cinnamon, there's a meta-analysis that was done of all the randomized controlled trials out there, and they found insufficient evidence to support the safety and effectiveness of routine use of cinnamon supplements in diabetes. That being said, cinnamon is delicious. You can use it to flavor up foods. It's a great way to kind of meet those sweet tooth cravings without using sugar. So I love cooking and flavoring things with cinnamon. And so I think it's great to actually use cinnamon in your cooking. But purchasing, spending money on supplements doesn't seem to be validated in the research. Now, with vinegar, evidence suggests that vinegar may effectively improve blood sugar control for both those at risk of diabetes and those with type 2 diabetes by consuming 1 to 2 tablespoons of vinegar before mealtime 1 to 2 times per day. And the research here was very intriguing, and definitely, vinegar, you can use all different types of vinegars. You can take it itself, which may not be the most palate pleasing thing to do, but you could also, again, incorporate it into your meal, into salad dressings, into marinades, and that is another way to get that 1 to 2 tablespoons at mealtime. They also looked at commercial vinegar supplements and found that these do not provide the same benefits as liquid vinegar. And these supplements are also not standardized or regulated. So again, better to go with the real food here when it comes to vinegar. So this is nutrition for diabetes, but I am going to briefly touch on, as we wrap up today, the physical activity benefits for managing blood sugar and some of the guidelines there, just to give us the whole picture of how we can best influence our blood sugar with lifestyle factors. So when we look at controlled trials out there, they found that structured exercise that people were consistent with for 8 weeks or more can lower A1C by an average of 0.66% in people with type 2 diabetes. And here's the kicker: even without a significant change in BMI. So for people that were doing consistent exercise, they were in a consistent routine for 2 months or more, even if they did not lose any weight at all from exercising, they still saw this improvement to their blood sugar. So that is very encouraging, I think. When we talk about physical activity, the general recommendations are to work your way up to 150 minutes of moderate intensity aerobic activity every week. So that would be about 30 minutes, 5 days per week. And you could also break down that 30 minutes into smaller sections throughout your day. So 10 minutes in the morning, 10 minutes around lunch, 10 minutes in the evening. And moderate intensity is really at the level of brisk walking. It's just enough to get your heart rate up. And then in addition to that aerobic activity, or what we like to call cardio, we also encourage strength training 2 times per week. And this is just working all your major muscle groups using light weights or even your own body weight if you're doing, push-ups or sit-ups or wall sits. And so all those fun ways to torture ourselves, but it's so good to strengthen our muscles and help our metabolism in that way. And lots of good research on combining these 2 types of activity for overall health and also specifically for blood sugar control. So a few things to consider with physical activity. You want to distribute this over at least 3 days per week and at least 10 minutes or more per session. So we don't want to get that 150 minutes all in 1 or 2 days and then be sitting around the rest of the week. We want to kind of spread it out. Also, adding in that resistance training, that muscle strengthening in addition to our cardio. This particular research study showed that over a 9-month exercise program, that combination of those two types of exercise improved A1C by 0.34%. And equally important as being active is not being too sedentary. So breaking up that prolonged sedentary time is associated with moderately lower post-meal glucose levels. So after our meals, that blood sugar goes up, comes down. But if we're not sitting as much throughout the day, that happens a lot more effectively as far as lowering our blood sugar levels. So the recommendation is to interrupt prolonged sitting every 30 minutes throughout your day. I also wanted to, as mentioned, touch on some weight loss considerations. So research shows that for people with type 2 diabetes, a moderate weight loss of 5% appears to provide beneficial effects on not only A1C and blood sugar, but also our lipids and blood pressure, and that a weight loss of greater than 15% of our initial weight can help achieve optimal outcomes, but that is going to require a much more intense intervention. You're going to have to really make sure you're restricting calories, that you're committed to regular physical activity plan, and having frequent contact with health professionals to make sure you're doing this safely and you're not overly restricting yourself, and also just having that accountability, support, and encouragement. So most people starting with a 5 to 10% weight loss of their current weight, that's a great starting place to see if it moves the dial on your lab values. However, weight loss for many overweight or obese individuals with type 2 diabetes might not be a realistic primary treatment strategy for improved glycemic control. For some people, weight loss doesn't show much of an impact on their blood sugar, whereas for others, weight loss is a very effective method for improving their blood sugar. So there is some individual factors at play here. And so for some folks, as we saw, exercising reduced A1C regardless of change in body mass index. So regardless of change in weight, we don't have to be super hyper focused on weight as a method to manage our blood sugar. We can still just focus on those behavioral changes, our lifestyle factors, and still see good results. So in summary, as we wrap up today, let me know if you have more questions in the chat box as I go through our summary. Recommendations to manage blood sugar and prevent complications of disease include working with health professionals to choose and customize a healthy eating pattern that works for you as an individual. And this includes increasing fiber from whole grains, legumes, nuts, fruits, and vegetables, and decreasing added sugars, especially from those sweetened beverages and from refined processed foods. Also want to be sure and consult your doctor before starting supplements that claim to improve blood sugar control. And the physical activity recommendations are to engage in 150 minutes or more of aerobic activity each week, plus resistance exercising 2 to 3 times per week, plus decreasing sedentary behavior. And then if weight loss is part of your treatment plan or your management plan, you want to achieve and maintain a 5% weight loss of your initial body weight if overweight or obese. So these are some practical resources for managing diabetes. Just some really, the American Diabetes Association has such a wealth of information on their website. Cornerstones for Care. If you sign up there, they often send free cookbooks to folks, and you register, but there's no payment or anything. They just want your email, and then you can view all the resources on the site. And Lilly Diabetes also has a really strong education library of different topics, all different kinds of topics you could possibly be interested in around blood sugar. I also wanted to include some diabetes friendly recipes. So these are some of my favorite websites that you can use to see different substitutions or different low carb meals. All those different eating patterns we talked about is kind of sprinkled throughout these recipes as well. So I'll be sending out this PowerPoint and you'll have access to all of these resources. So thank you all so much for joining me. I hope you enjoy the rest of your day. And if you do have questions or comments, feel free to reach out to me at kate.watts@conehealth.com. Thank you so much.